Hi everyone, Dr. Rich Castellano, the Smile Doctor. We're here today with Jerry. Jerry, thank you for letting us share your video today. Jerry's been a patient for a long time, and today we're doing a little bit of the Botox for the armpits or the axilla because it really does a great job with sweating in the armpits. So I'm going to do a little cleanse on the skin. So Jerry was telling us that you've been doing it for a while now, but what was it that inspired you to say, you know what, I'm going to do this?
I was up in Connecticut and I went to see my dermatologist.
Yeah.
And he said, "How's everything?" And I said, "Well, geez," I said, "everything's great except, man, I perspire. I've tried Mitchum's, I've tried pads, I've tried everything. I can't get rid of it." And he looked at me and he said, "Well, you haven't tried Botox." And I said, "Botox for what?" And he said, "I'll inject you." And he said, "I guarantee you will not have this problem again." And that was 15 years ago. And then I moved to Florida and I found Dr. C here. And he's been fabulous. And I get my injections and I come every 6 months to 8 months.
There you go. And this is the area for the physicians and students that are watching. So right in the middle of the axilla, and I'm just going to line it out a little bit of unit here or two, right subcutaneous. I don't go deep to do it. I like to use my little buzzer. And so you'll feel a little pinch here on 3. 1, 2, 3, pinch. Not too bad there?
Nope, not at all.
So I'm not in a hurry if you need a break, pinch. So you're it's a field dose around the area, pinch. And I'm just kind of following the border first, and then I'll just come across. So very straightforward, very effective.
Very effective, yes.
If patients,
I can attest to that.
Yeah, if patients need to come back for little touch-ups, they can, but that's not very common.
No.
So we go nice and easy. How are you doing? You doing okay?
I'm doing great.
Not too bad?
No, not at all.
We try and make it easier than the dentist's office.
Oh my God, I was just going to say, I'll take this over a shot of Novocaine any day. It's yeah. So, and I know what to expect, but it's not painful. So anybody that wants to do this.
Yeah, and it's important that you have someone who knows what they're doing because you don't want to run into troubles with this. If you go too deep, you can cause other problems. There's vital structures there, but we're staying very superficial.
Yep.
That keeps it safe. And safety is always first in our office.
Right.
So how does Botox make this happen? So what happens is Botox, which blocks the nerve conduction from the nerve to the muscle at the motor end plate, it does the same thing from the nerve to the sweat glands. There's a little bit of muscle activity that causes the perspiration and expresses it out. So that is something that the Botox actually blocks that transmission from the nerve.
Okay.
We'll pinch. Thank goodness for modern medicine.
Yes, I'll say.
I like to use the little buzzer as well because
the buzzer's great, by the way.
The buzzer helps. The brain can only focus on so many things at one time.
Yeah.
So the buzzer does help.
It was like my golf game today. I can only concentrate on one thing.
Haha, that's right.
Yeah.
We hit some golf balls the other day. I don't golf much at all, but my son's birthday was a couple weeks ago, so he wanted to go to Topgolf. I really had a good time swinging the golf club.
Oh,
it was fun.
It's great. That little ball sits there and waits for you to hit it.
Yeah.
Yeah.
Okay, so we're done on this side here, the last little spot. Now, what we're going to do is I'm going to put a little bit of gauze, and you can go ahead and just close your arm down on that.
Okay.
That way, if there's any little drops there, that way it'll. There we go. And we'll do the other side. So we're doing both sides today, correct?
Yes, absolutely. Yep.
And so some people will even do it in their hands.
Oh yeah.
But
that would be painful, I would think.
Yeah, it's a little more sensitive there.
Yeah. But I've heard that. In fact, the doctor up in Connecticut told me that. I said, "Geez," I said, "Do you where else do you do this?" And he said, "Oh, I do it in hands and even I think he even said elbows." Is that ridiculous?
You can.
Really?
Yeah, if people notice that there's an area that they sweat a lot, it works everywhere.
Wow.
Feet too.
Yeah.
So you have a question? They're asking, what does this do?
So the Botox blocks the sweating, and to have special fancy names for everything. So call it the axilla or the armpit, but it's just a subcutaneous superficial injection. She's been getting about 6 or 8 months result, which is awesome.
Yeah.
and saving the blouses and the shirts.
Oh
Of
my,
course, we live
yeah,
in
wardrobe.
Florida, you know, and
Yeah.
I wear a jacket everywhere I go because it's so cold from the air conditioning in Florida, right? So,
Right.
but if you're looking to reduce the sweating, this really does a great job.
This is the only way to go. The only way to go.
Little pinch.
Yeah.
Little therapeutic acupuncture.
Yeah.
Takes your mind off of everything else in the world.
Yes, it certainly does, especially what's going on in the world today.
Oh my goodness.
Yikes.
I have to remind myself not to watch the news so much because
You know, I don't either anymore, Doc. I used to be a news freak, and I can't watch it anymore.
It's tough.
It's too depressing.
you know, there's a lot of tough things going on. There's a lot of beautiful things going on.
Right.
So just do the best we can, and
Right,
the
absolutely.
rest is in God's hands. But it's just,
Yep.
I'm very grateful to be here today. We have the best patients. We have the best team, and
Right.
it's up to us. We got it. I'm still the optimist.
Right. Right.
I'm still the optimist.
Oh, that's good. That's the only way to be.
All right, so if you're just now joining this video, we're doing Botox to the armpit to reduce sweating. It's very effective. It's very easy to do. You feel little pinches or not so much at all.
Right.
And I'm just covering the entire area of the axilla for my physicians and students that are watching. Let us know if you have questions. If you need to make up your cosmetic continuity plan, give us a call. We've just opened our office in Tampa, which is wonderful. We've got our busy office here in the Villages. So all through this area, I'll do a little bit more up top.
Okay.
And there are no restrictions after you do the Botox to the armpit. Perfect. Okay, so go ahead and you can put your arm down over that, so that way if there's a little drip drops there. Let me just check the other side, because you should be good by the time we're...
Yeah, usually I'm not a big bleeder, so.
Yeah, no significant bleeding.
Okay.
And let's take a look on this side here.
I'll swing my arm if I hit you in the head.
Very good. No, yeah. That was,
Got a
don't
duck.
hit the doctor. That's so
That's
embarrassing
not
the
good.
last time that happened. So, very good. So, we're all set.
Okay.
Jerry, thank you for letting
Can
us
I-
share.
Can I ask you one question?
Yes, of course.
Maybe not on the.
Okay, well, we're done with the video, so we're going to talk. But thank you for watching Botox to the armpit for sweating. We'll see you in the next video.
It's great.
Let me sit